I'm Dr. Amelia and I'm the clinical director and a psychologist at the Traverse Bay Children's Advocacy Center, and this is my first official vlog for the CAC, so please bear with me. Today I wanted to talk a little bit about our theme of talking about sexual health. One of the things that I hear from parents a lot when they interact with other parents is, well, my children's friends' parents don't use appropriate terms for body parts, don't kind of shy away from discussions of sexual health and well-being. And I want to talk to them about it, but I don't want to preach to them about it. And I think that's a really important distinction because I think that puts people off a little bit and puts many of the parents I work with off, as they don't want to be preaching and lecturing to other people. And so one of the pieces of advice I often give parents when they talk to me about this is telling instead of lecturing, and modeling instead of lecturing or preaching, as people would say, I think is a much more effective way to communicate that information to other parents. And so an example of this would be when you have your friends over with their kids and your kids are using the bathroom. Well, ask them, did you wipe yourself? Did you wipe your vagina? Did you wipe your bottom? Use the appropriate terms and just a normal everyday conversation with the children when you're asking them things. Older kids, share with your friends that have adolescents. Share with your kind of successes and challenges with talking to your kids about sexual health and well-being appropriately for their age. When you talk about those things and you say, I talked to Jane last night, I'm really concerned that she might be interested in a boy and they might be talking about having sex, and I'm just really struggling with the best way to talk to her. This is what I did. This is what I said. Being able to talk to other parents about those things and share your struggles with them will probably open up the lines of communication with them and be able to have those discussions more appropriately, and where another parent isn't feeling threatened or kind of weirded out by you bringing it up. Another thing, just as far as modeling goes, that is a great modeling piece for other children that are around when you have infants is, one of the things you do all the time during the day is change diapers of babies. And being able to model to other friends that might be over, other parents that might be over, children that might be over, what you're doing to the child, and talking to the child while you're changing your child and saying, okay, well, right now I'm going to wipe under your arms with a baby wipe because some poop got up there and I need to take care of it. And I'm wiping your vagina and making it clean, or I'm wiping your penis and making sure it's clean. Oh, and we're going to put the diaper on now. And these things all sound kind of strange, but it's all you're doing is talking about what you're doing to the child and making the child, even at that extremely young age, aware of and starting to be more comfortable with using proper anatomical terms for body parts. And you're showing other parents that you're comfortable with that, and sometimes that may make them feel more comfortable with doing those things themselves. All right, well, I hope that was a helpful point and discussion to have today, and I look forward to continuing doing some more vlogs. And stay warm and dry if you're in the Midwest right now. I've got my snowman pin on as in solidarity with all these freezing cold snowmen out there. Thank you, and I'll talk to you guys soon.